Turns out, GLP-1 drugs are the first effective medical treatment for obesity in medical history. There are many aspects to GLP-1s, but we'll focus on one today: the potential medical revolution these drugs could mean for obesity, one of the most deadly chronic diseases of our time that over 1 billion people suffer from and that remains largely unsolved and underfunded. Then the world changed overnight, and suddenly our modern food environment hijacked our biology. Food is a product now and has become cheap, calorie-dense and hyper-palatable, which means it's been engineered with addictive levels of sugar, fat and salt, making our reward centers go ballistic with joy. This is exactly where GLP-1 drugs interact with our biology. The glucagon-like peptide 1, or GLP-1. It's one of the hormones your body releases after a meal. It tells your pancreas to release more insulin to keep blood sugar in check and slows down your digestion to keep food in your stomach. And in your brain, it increases your feeling of fullness and being satisfied, curbing your appetite. GLP-1 signal that stays in your body would boost insulin and silence appetite. But the revolution came with semaglutide and tirzepatide, Ozempic and Mounjaro. They send out a loud and steady signal that dials down your appetite 24/7. You still enjoy food, but you feel full and satisfied much sooner, making it easy to not overeat. How intensely you feel hunger is largely genetic, so especially people who suffer from food noise, a constant urge to eat, feel a huge psychological relief from the drug. Finally, their body stopped screaming at them. It feels magically effortless. On the weight loss side, these drugs are incredibly effective. In 3 months, you can lose 10% of your initial weight. 3 months later, over 15%. And after a year, you may reach more than 20%, a level of weight loss that used to only really be achievable through bariatric surgery. We can't stress enough how unhealthy obesity is, causing everything from diabetes to heart attacks and cancer. Treatment with semaglutide cuts your risk of stroke or heart attack by 20%. 17 months of tirzepatide crashes your chances of developing diabetes by 66%. But of course, there are side effects. Most commonly nausea, vomiting, diarrhea and constipation. Not fun, but usually harmless and fleeting for the vast majority of patients. Apart from this, the main downside of GLP-1 drugs may come from their greatest strength, rapid weight loss. If you don't actively check what you eat, taking these drugs is just an unhealthy crash diet. And so, while these drugs change your biology, they don't do all the work for you. Staying healthy still requires you to adopt healthy habits. In a nutshell, the best thing these drugs do is to remove the pressure of intense hunger and food noise, to give you a time window where you can change your habits.